This afternoon, good afternoon, everyone. This afternoon is going to be a sharing, and I brought with me a prop because I would like to show you how different I can quickly become, separate from you. Because if I put on my white coat, I suddenly become a doctor. And I suddenly become different from you, right? The white coat is something that gives us a status symbol. There are medical students here. There are medical students the other side. And, this is something that represents a noble profession. It is something that represents intellectual capacity. You cannot be dumb if you're a doctor. This is also something that represents that, my God, if he's a doctor and he went through med school, he probably has the money. When you go on a vacation with groups and they know that you're a doctor, they feel very, very comfortable. And that's precisely why sometimes doctors don't want to be introduced that there's a doctor around, because we are on vacation. So when somebody in the intercom in the plane, is there a doctor on the plane? My God, you'll be amazed that so many doctors won't stand up, because if it's an international flight, you want to be a good doctor, you end up being sued. And let me remove this now. So I really like, when I was 7 years old in Binalbagan, Negros Occidental, my mom is a pharmacist in a hospital. It's a community hospital. And my chums were either sons of the doctor or son of a nurse. No? And we would always be in the hospital whenever there was an ambulance, with the siren. Because we are kids of the people there, we would be given the chance to get inside. No? We all wanted to become a doctor. And one of the doctors that I really thought was one reason that made me want to become a doctor was Francis Abelio. Tito Francis, we call him Tito Francis. He was this man in white. He was always immaculate. He was very composed, calm. He was very nice. He was respected by the rich, and he was loved by the poor. He was a hero, in other words. And my mom would always have, when we have lunch, she will always have some anecdotes about the prescription habits of the doctors in the hospital. Some of them good, some of them bad. But she would always spare Tito Francis. Tito Francis was always somebody who couldn't do no wrong. No? I wanted to become Tito Francis. I wanted to be a surgeon. And as a matter of fact, one of the times that there was an ambulance and there was a teenager who was actually gored by a carabao in the province, and there was a punctured wound. And I was with my friends who all wanted to be a doctor, and the doctor poked something, and there was blood. My friend I did not know that. Akala ko sa movies lang, na you just flip backwards, and then he collapsed and he fainted. And because I did not faint, I knew I was going to be a very good doctor. Now, one of the things, however, that I use this, because I do sometimes, depending on whether I feel that it's necessary, I do house calls. And sometimes I drive my car and I go through areas where, it's actually slum area. No? I bring that with me with my stethoscope slung over around my neck. It makes me safe. Okay? But on the other hand, I realized that the white coat is also something that sets me apart from the rest of you. And not in a good way. As a matter of fact, that's why I am now refraining from using the white coat in my clinic, is because of this white coat syndrome. It makes patients, blood pressure go up. Yeah, that's a blood pressure. And so, you know, the white coat is something that, you know, what I'm sure the medical students in the other room would really identify with that. No? So I'm supposed to talk to you and share with you exactly, you know, the partnerships with patients. No? And it's important, I think, because some of you will be doctors, some of you are patients. All of us will be patients before we die, you know, unless, you know, you get shot in Ampatuan. You never have the chance to be a patient. No? And I think it's important that all of us understand where the doctor is coming from, because doctors also should understand where patients are coming from. So when I was in high school, I kind of, you know, wanted to have an adventure. I actually went to the seminary. I wanted to be a priest. That's what I told my mother. My mother loved it so much. I was going to be a priest. But you know, we did a lot of praying in the seminary. And that's precisely, perhaps I have already exceeded my quota of prayers. I don't impress my friends here that I am a prayer. And but in the seminary, the Redemptorist Seminary in Cebu, I discovered so many things. Now that was in the. I don't impress my friends here that I am